Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. Welcome back to the Endo Kids Podcast. I'm Dr. Rinku Mehra, pediatric endocrinologist.
And I'm Dr. Lindsey Waldman, also a pediatric endocrinologist. Today, we're talking about delayed puberty in boys, one of the most common reasons families come to see us.
And we're going to break down today what's normal, what's not normal, and how we help boys who are struggling with being late bloomers.
So let's first talk about what is normal puberty in boys. For boys, puberty usually starts between the ages of 9 and 14, and the first sign in boys is testicular enlargement. It's not underarm hair, it's not pubic hair, it's not voice changes, it's that testicular enlargement.
Yeah, and actually, when you bring that up, the hair development can happen pretty early, but that does not signal that the boy is really in puberty. So like you said, the first sign of puberty in boys is testicular enlargement. And a lot of times, the parents don't actually know, right? Because the boy is 9, 10, 11 years old, taking a shower by themselves, really more private about getting dressed. And so they really don't know. So the first sign usually is testicular enlargement. And if a boy reaches the age of 14 and has no signs of puberty, we consider that to be a delay in puberty. So we often give boys until that time period, until they're 14 years old, to see if they have any signs of puberty at all before we call it delayed.
Absolutely. And when you think about some of those signs that you might be looking for with delayed puberty, they might be shorter when you're comparing them to their peers. Again, they don't quite have that pubic hair yet. They have not had a voice change or a growth spurt. And of course, they're starting to feel embarrassed or left behind socially. I know that I hear that all the time. My son is the shortest one on the basketball team or is the shortest one in their classes, and they start to feel bad about that. This can be incredibly emotional because, of course, everyone notices when they're different, especially at these ages.
Yes. And the big thing that we talk about is growth. So they can be shorter than their peers with regards to height, but otherwise, they have a normal growth pattern. So it's these boys just haven't hit their growth spurt yet. And I think that's an important piece to look at. And that's what we look at as pediatric endocrinologists when, these boys come to see us. Often they're not actually coming to see us for delayed puberty. What they're coming to see us for is that they're small or they're short. So they're coming to see us for short stature. But in fact, they really have delayed puberty. And that's what we are there to guide parents through. Like Dr. Waldman said, it's very emotional. Boys are feeling different. Sometimes they're bullied at school because of their height. And it's important to recognize that can be a normal variant. So this is really what we call the late bloomer syndrome or constitutional delay. It is one of the most common causes of delayed puberty. These boys are healthy. They're just slower in timing. And often what I find is that there's a strong family history. Usually it's the dad who had delayed puberty. Sometimes it's the mom too, but there's a history of delayed puberty. So dads will say, I grew after high school. And this is one of the most common causes. There's other causes of delayed puberty that we look for also. So certain genetic conditions that can lead to delayed puberty, sometimes chemotherapy or testicular injury. Again, these are pretty rare causes of delayed puberty. And then undescended testes can also cause delayed puberty, although I actually really haven't seen undescended testes as a cause of delayed puberty in many years, because I think that's picked up by the pediatricians pretty early on and then the urologists. Other causes of delayed puberty So sometimes it can be chronic illness or nutritional issues that can lead to hormonal or pituitary causes, decreased brain signals that can lead to delayed puberty, and excessive athletic training. Interestingly, some athletes do have delayed puberty. They're exercising quite a bit. They can be underweight. Also, there can be some nutritional issues. So some of these things are combined as causes of delayed puberty.
Absolutely. And you mentioned a lot about nutritional issues, and I'd love to just talk about that for another second before we move on, because a lot of times that's what we're seeing as part of the cause of this delayed puberty. A lot of families struggle with picky eating. I like to sometimes call it selective eating. Many of these families will come in and say their children are just not hungry and they're underweight. And so a lot of what we do is looking for causes. A lot of times we'll find that everything else looks normal, but nutrition is really the place they need to focus. And so I find a lot of my time is talking about food, which I always love to talk about.
Yes. And I have had, like I was telling you earlier, a whole host of patients in my practice recently who have been delayed with puberty. And the most common cause for them is nutrition. And I think it's very frustrating for parents also, parents of these boys who have nutritional issues, because you just do want them to eat and eat more calories. And getting the calories in often is enough to stimulate their body to start going through puberty. So I often tell parents, you need to have a little bit of body fat to start going through puberty. And we do help with that too. So we can help push that along. But nutrition is super important. We evaluate delayed puberty all the time in our practice. And really, the key is looking at the growth charts and looking at the growth patterns. And we're trained to do this. We look at growth charts all the time, often with a fine tooth comb and just looking at the patterns of growth. But we look at the growth charts. We do labs for our patients. We will do an x ray, often a bone age that we talked about before. We look for nutritional causes. We look at their thyroid function, sometimes prolactin. And then overall, a good physical exam is often very important to see what the cause is, because there's lots of different causes of poor growth and delayed puberty, and we just want to have a good picture.
Absolutely. And you mentioned bone age before. And just to remind everyone, that's an x ray of the left hand. And it is extremely helpful when we're talking about growth in puberty. Many of these boys who have delayed puberty also have a delayed bone age. So, a bone age that is younger than their chronologic age. And that means that they have some extra time for growth, which is always a great thing to be able to tell families.
These boys often have a little bit more time to grow. And when we talk about bone age, Dr. Waldman, a common question I get from parents is, my dad or grandfather grew till he was 21. And is that the same thing that's going to happen to my child? What do you tell parents who say that to you?
I get that question all of the time. And I tell them it really depends on that bone age. So yes, if you have a family member, a friend, etc., that grew later, what that means is that their bone age was very likely delayed, younger than they were. If you have a family member or a friend that grew really quickly and then stopped, what that likely means is that their bone age was advanced or older. When we think about boys and their bone age, their growth stops when their bone age is about 16 years old. So again, that is not a chronologic age. It doesn't mean that every boy stops growing at 16 years. It means that when their bone age shows about 16, that's when the significant growth is done. So again, that piece of the puzzle is really important in our visits, and we're able to talk about how much potential growth these boys have left.
Exactly. Yeah. So that's a very common question that I get in the clinic as far as growth for boys. And parents are very anxious about their boys and their height. And oftentimes they're coming to us asking for growth hormone or seeing if the child needs growth hormone. And that's something that we clearly evaluate in the clinic to say, is this a child who has a growth hormone deficiency, or is this a child who is a late bloomer? Because sometimes they can look the same as far as the growth pattern and the growth picture is concerned. Really important to have a pediatric endocrinologist really look at that and make that determination. But when we talk about treatment options, Dr. Waldman, what do you tell parents about treatment for delayed puberty or late bloomers?
Absolutely. So, after we do that evaluation again with a great physical exam, looking at the growth charts, possible blood work, bone ages, etc., when we think this is, quote, the late bloomer, constitutional delay of growth in puberty, most of the time it's watchful waiting. It's looking at that growth chart again, maybe in about 4 to 6 months, and seeing where the growth is going. Now, that can be a very frustrating thing for families and for patients, but a lot of times these boys might grow on their own, and we can just observe over time. Now, that might not work for everybody. And for some of these boys, we can do something else, like a short course of testosterone or potentially treating some of these underlying conditions that we may have found in our evaluation.
Yeah, so the short course of testosterone usually I find is one of the most effective and supportive tools. A short 4 to 6 month course can usually jumpstart puberty, and parents often ask me, is this a safe treatment? And we are using this quite a bit. We're not doing testosterone to help build their like body build or anything like that. We're just giving them a boost to go through puberty to see if their body can then start to pick up and do it on their own. And like Dr. Waldman said, we also will look at underlying conditions. So nutrition, thyroid, chronic illnesses to see if there's anything else. We will look to see what their exercise patterns are. Oftentimes, these athletic boys also have some delay in puberty too. So we will look at that and try to optimize their nutrition as well.
And once we come up with treatment, come up with a plan, I will say that most boys catch up completely once puberty starts and end up at whatever height is appropriate for their family, knowing that every family is different.
And for boys who need support, oftentimes it's usually that short course of testosterone that can make a huge difference in their confidence and their growth. But parents often have a lot of questions. Dr. Waldman, there's a few questions that I get all the time, and these are some FAQs for parents. So parents will often ask, or they'll think about it in their head, may not say it in front of the boys, but they often ask me on the side, okay, he's short. Is he going to stay short? And what is your response to that?
Sure, that's a great question. And many of these late bloomers will grow later. Like I said before, they will get to the height that's appropriate for their family. Again, remembering what is appropriate for each family is different. They will just get to that height later. Again, that is assuming that in our workup, everything looks normal and beautiful and wonderful. But again, most of them will reach their growth potential. I have a question for you, Dr. Mehra.
Yes.
When I talk about testosterone, if we're going to do potentially a short course, I get a lot of questions. And does it stunt growth?
So testosterone does not stunt growth when it's used properly. Okay. It often accelerates normal development and helps just give them a boost. But I will say that in the last 2 years, I have had a great number of these boys who have researched things online, looked at TikTok, mainly it's TikTok actually, and have somehow purchased testosterone supplements from places that they're not even willing to tell me where they bought it from online. And they're taking huge doses of testosterone to help them grow and develop. And I just want to make a comment there that this is very unsafe. In those cases, when you're taking large doses of testosterone without medical guidance, sometimes using ChatGPT, to be honest, as far as what the dosing strategy should be, in those cases, it can be harmful and it can potentially stunt growth and fertility and some of these other things that we worry about in boys. Testosterone, when given from a pediatric endocrinologist or a respected physician who has treated this all the time, is very safe and will not stunt growth. But you really have to be careful as to what you're looking at online.
Absolutely. And you can't even be sure exactly what you're getting. And I think that's something that is also really scary. They might think they're buying testosterone, but what are they actually getting? And that's absolutely what scares me.
So I have a question for you. So should, if a parent comes to you and asks, Should I worry if my 12-year-old hasn't started puberty yet? What do you say?
That's a great question. And my answer there is no. 12 years old for a boy is still totally normal not to be in puberty. That being said, we're always watching growth. So monitoring their growth chart is really important. And like we said earlier, if by 14 you're not seeing any signs of puberty, that's probably a good time to get an evaluation by a pediatric endocrinologist just to make sure that there's no other underlying reason.
Yeah, and the biggest issue is that not that there's anything dangerous, but delayed puberty can be stressful from a psychosocial perspective. And I think even for that alone, I think it's important to get evaluated. Some boys may need a little bit more time or a little bit of support or maybe a short course of treatment. And I think it's important just to for their mental health also to get them evaluated earlier and to avoid some of this online searching also for treatment options.
Thank you so much for joining us today. We hope this episode helps parents feel informed and empowered.
This has been the Endo Kids Podcast, where little hormones meet big answers. Until next time.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.